Every face ages differently. Skin loosens, ligaments weaken, and the volume shift. That is why I developed a system to identify the patterns of aging in each patient. This is very important because with that, I can accommodate the plan according to the specific phenotype of patient. That is how I can restore structure, improve the definition, and get a natural result. Facial aging changes the architecture of the face in very specific ways. The skin loosens, supports weakens, deeper tissues descend, and volume shift from one area to another. These changes do not happen in the same way in every patient. Different layers and different regions age differently, which is why facial rejuvenation requires a more precise and individualized reading. In some faces, the upper face leads the aging process with broad descent and fatigue around the eyes. In others, the midface becomes dominant, with cheek descent, deeper nasolabial folds, and loss of central support. And in others, the lower face and neck define the pattern more clearly, with loss of jawline definition, jaw formation, and increasing neck laxity. Once I identify the dominant region, surgical priority becomes clearer and the plan becomes more precise. That reading is where everything starts. Modern techniques shift toward deeper support, more favorable vectors, and more selective repositioning. When I work at that structural level, the correction distributes more harmoniously, the skin settles with less tension, and the result looks balanced and natural. In selected areas, particularly the upper face and mid-face, endoscopic visualization adds another level of precision. Direct sight through minimal access allows the anatomy to guide the correction more accurately. A patient with broad descent and mid-face volume change needs a different strategy than a patient whose dominant concern is the lower face and neck. Same decade of life, but a very different surgical plan. That individualization is what separates a plan that fits from one that simply repeats a technique. When the dominant area is treated with precision, definition improves, support is restored, and the face begins to look more unified as a whole. That is where judgment matters most. Great rejuvenations come from a plan that is precise, measured, and individualized.